Welcome to the North Phoenix Chamber of Commerce's Lunch and Learn today. Our topic is going to be around the healthcare product that we've put together as a chamber benefit for our members. And I'm going to introduce Zach Wethington. He's with the Mahoney Group. He's one of our chamber members, and he's worked really hard to get this together. And he has a guest with him today as well that's going to talk about the new insurance, or no, we're not allowed to call it insurance, the new healthcare plan that we've put together for chamber members. So Zach, without any further ado, I'm going to let you drive.
Awesome. Thanks guys for jumping on the call today too, as usual. A few months back, Tom and I were talking, and I mentioned, given that this is what I do, I said, why do we not have some sort of reduced cost healthcare plan for chamber members as part of a benefit for signing up? And he mentioned, he'd been shopping around for some time now trying to find something. But the problem is that everybody that came to the table with something didn't have a solution for the individuals or the solopreneurs, which we have so many of in this chamber. So I said, all right, understandable. So I went to work and I tried to find one. Luckily enough, I did find a couple of them. And after speaking about the details and going through the nooks and crannies of the plans, David Sleepak actually came up with a solution to all of our needs that would allow us to not only have that option for individuals to sign up, but additionally to have more than just the one option that I found with the other company. So David, if you don't mind, if you want to jump in there and kind of give some details and kind of walk us through what the plan looks like.
Absolutely. Thank you so much, Zach. There's two real important components, if you will, to healthcare, right? There's healthcare, and then there's health insurance. And to successfully reduce cost and deliver better value to an employee, an employer, an individual and family, we successfully do that, right? So, when you buy car insurance, you don't necessarily think that State Farm is going to do your oil changes or your tire rotations, right? However, you do expect that when you get rear-ended by 50 miles an hour, by a Suburban, that they're going to facilitate fixing your car, right, or taking care of your medical bills. Well, the same thing in healthcare. So, what we have successfully done through a product that is called Ease Plans, we've separated healthcare from health insurance, and we've done it in a very mindful way using ACOS as a virtual primary care solution. So I'm going to go through two components here. I would like to share my screen if that is possible.
You should be able to. I think I enabled that option.
Awesome. So give me one moment here.
I'm just going to be really clear here too. ACOS is one of the product lines that Zach has access to. Is that correct?
That's correct. Yep.
And that's how we're configuring this. We're not bringing in somebody from outside of the chamber to be putting this together. This is through Zach. Zach is the representative here. He's brought in the expert that provides that they've sourced the product through. So,
and I'm here supporting Zach and kind of the subject matter expert on these different solutions. So I appreciate everybody joining the call this afternoon. And again, we're going to go through a couple different pieces of the puzzle here. Everybody has access to an exclusive website and landing page that we created specifically for the chamber. This solution is very important that you access, and I'm sure at the conclusion of the call and over the next several weeks, Zach and team will be sharing this enrollment link with you. So I'm going to show you a few things about the website that we've created specifically for the chamber and some of the plans that are associated with it. And then I can answer any questions that you might have. So the first thing you're going to want to do is learn a little bit more about the plans today. And for the folks that are on the call, the folks that are going to be recorded or watching the recording, you're going to benefit from me kind of explaining how the plans work, which is really cool. So you'll learn a little bit about the plans. There's the healthcare plan. There's actually a dental offering that's associated with it. And then there's the virtual primary care solution that is embedded inside each one of these plans. So very cool. And I'll explain each one of these here in a little bit more detail. The other piece that you'll be able to see is a summary benefit sheet. And as you scroll down, there's 4 plans that are being offered exclusively to the North Phoenix Chamber. And Two of these plans are what's called primary and premium. These are what would be considered minimum essential coverage. So what that means is under the Affordable Care Act, and these are certified Affordable Care Act plans, these are going to cover those minimum essential coverage benefits. So what are those? That is a annual physical. That is a well woman exam. That's a colonoscopy. That is a mammogram. There's a whole host of drugs that are $0 copay, for example, non-smoking medicine. Statins are on the list. Birth control is on this list as well. So the primary plan that you see here today has no out-of-pocket costs for all the services that I just mentioned. It also has what we call unlimited virtual primary care with a dedicated primary care physician, as well as a dedicated care navigator. And I'm going to go into a little bit more about ACOS and that benefit for the chamber as well. And again, it's included on all of these plans. So the first plan is pretty basic. It's called primary. And again, it includes unlimited virtual visits with your primary care ACOS doctor, and then those wellness benefits that I mentioned. As we start to move towards the right here, we end up at the premium plan, and this is a little bit more comprehensive. This is going to have some copays for primary care office visits. It's going to have a copay for urgent care visits. It's going to have some copays for specialist office visits. And it's also going to have some outpatient services. So this is around mental and behavioral health. So if you're going to see a counselor or potentially a psychiatrist, and then any sort of substance abuse as well. This plan also offers a supplemental hospital benefit. So what does that mean? Well, if you are admitted to the hospital, we're going to pay you out $1,000 a day for a maximum of 5 days based on the billed charges of your hospital stay. Okay. Laboratory and radiology services. So if you're getting labs or you're getting an X-ray, there'd be a $50 copay. And then if you start getting the more complex imaging, like MRIs or CT scans or PET scans, this and that, it would be there'd be a $500 copay associated with that. Okay. Again, all of these kind of stack on top of each other. So as you see, all these plans are going to have those wellness benefits built in as well. Okay. The next two plans, the bronze and the silver solutions, are what we would consider ACA compliant, and these meet what's called minimum value, or would constitute a major medical type of plan. So in addition to all the wellness benefits that we went to, in addition to the ACOS virtual primary care and some of the drugs that are associated with it, it's also going to have the primary care and urgent care and specialist office visits with copays, as you can see here. And then we're going to start to get into the major medical part of the plan, right? So inpatient hospitalization and inpatient surgery, there's a $350 copay per admission. This is limited to 5 days and 2 surgeries, right? Again, on the silver plan, limited to 7 days and 3 surgeries. Outpatient hospital services or freestanding surgical and surgery centers. Again, there's a copay associated with that. An emergency room visit, $350 copay. And then obviously some inpatient and outpatient treatment for chemical dependency and or alcohol abuse. That is part of this plan as well. Home health care. And then the last piece, obviously, on the silver plan is pregnancy benefits with a $350 copay. Okay. I want to make sure that everyone understands that these plans are available and to all of you, and you can pick and choose which one would make the most sense for you, for your spouse, for your family, et cetera, et cetera. If you want to learn more about more details on each one of these plans, you can click Learn More on the website, and it'll take you down to the summary benefit level sheets that will have additional information. The other thing that we put together exclusively for the chamber is some dental options with a dental insurance product. And we have the 1.5 and the 3.0. This is really self-explanatory. There's a maximum benefit, there's a family maximum benefit, and then fundamentally there's some free services like the oral examination, cleaning, fluoride, sealants, et cetera, and then there's some basic restorative features, like x-rays and endodontics and crowns and extractions and those types of things. Okay. This uses the Dentamax network, which is a very comprehensive network in the dental arena. Speaking of networks, I want to jump back because I did not cover the networks. I know people ask, well, is my doctor on the plan? Well, probably, right? So the primary and the premium plans, and if you're taking notes, this might be something you want to write down. They use the First Health Network, which is owned by Aetna. And then there's actually a PHCS wrapper that goes along these two plans, okay? So what that means is, and we'd be more than happy, I'm sure, Zach could, when you contact him, facilitate sending you the link for these particular networks to see if your doctor is in those networks. On the bronze and the silver solutions that we have here today, those use the PHCS network. Again, we can give you the link to facilitate that. And then it uses what's called an open network philosophy for these services here. So anything that would be considered a facility or inpatient. So what are those? The freestanding colonoscopy center, the hospital, the emergency room, et cetera, et cetera. That's what's called an open network. So what's an open network? Well, everybody's in the network. And we facilitate the payment methodology behind the scenes to those services based on a percentage of Medicare, which is another solution. Now, somebody, and I can't remember who, but I heard kind of a scenario with regards to Medicare age, spouse, right? And trying to figure out a solution for the under 65 crowd with potentially somebody that's a Medicare recipient as well. All of these plans would be an option for a spouse or a significant other who is of non-Medicare age, even though their spouse might be of Medicare age. So there's a lot of folks that they keep their job, right? To be able to facilitate keeping, wife or husband on a medical plan under their current employer. These solutions would be appropriate if you feel that the benefits are, what you think would be good for you or your loved one in that type of scenario. Okay, so I'm going to pause for one moment here, and then we're going to switch gears on a couple other things that I think are very important. There's some great features on this plan.
What are the costs involved?
Great question. We're going to get to that here in a moment.
Okay, all right.
Yeah,
So
absolutely.
My mind is also going for like dependents of ours, like my daughter's getting to the age where she's going to age out of my dependent benefits at work. So that would be someone that could jump on this.
That's correct. Yep, absolutely. Yeah.
If somebody has employees, so one of our chamber members might have a team working for them because we're not all solopreneurs. Is this available for their employees as well?
Tom, that's a great question. So there's two ways, and Zach's going to be able to help each one of you with how we can set this up for you, your family, and or your employees. So the first way is on this website that I'm showing you now. You actually go right here to the checkout page and fundamentally enter your date of birth. You pick the plan that you want, et cetera, and hit continue. And you would enter in all your demographic information that I'm showing you here. Okay. And then fundamentally your ACH information. And then you'd sign it. Okay. So that's way one. So for example, your daughter, if she were to want to enroll as a single on these plans, she would go here, she'd fill out this information, she'd pop in her checking information and hit go, and she would be enrolled. Okay. Now, if you have employees and you want to offer an employee benefit, right, to be competitive in the market, look, companies, that's kind of the status quo, right? Like, do you offer benefits? Yes or no? And to be competitive in the marketplace today, a lot of businesses, small, medium, and large, need to compete with benefits. That's a huge opportunity for you as a business owner to give your folks. So if you're going down that road, Zach will be able to facilitate what we call a list bill. And what he'll create is a census on a spreadsheet of you and your employees that want to enroll on the plan. And he'll submit that to me. And then what I would do is enter them all into the system with an effective date of 11/1. And they would come onto the plan 11/1, and every month you would get an invoice from our third-party administrator, which is basically the entity that's licensed to take insurance premium dollars. So you would pay the TPA on a monthly basis with an invoice of those people that are on your plan. And then you can do what's called a payroll deduction. So we have a lot of businesses that these are so affordable that they just pay the whole premium for their employee for the single. And then they're like, oh, if you want to add your dependents, or if you want to add your spouse, if you want to buy up, then it's on you and you can do a payroll deduction. We have other businesses say, hey, look, I'm going to pay 50% of your health insurance premium, or I'm going to contribute $100, whatever it might be. It's your business, it's your budget, and it's your money. And what you want to find is that ROI that makes a lot of sense. So again, there's two ways, Tom, to answer your question. I know that was pretty long-winded, but I hope it was a good information.
It was thorough. I appreciate it.
Yeah, for each. So we can enroll you as an individual or family. We can enroll your daughter. We can enroll that, spouse of the, the under 65 spouse of a 65-year-old on Medicare. Or if you have a business and you have 2 employees, 3 employees, 10 employees, 50 employees, that's cool. Zach will be able to set this up as a list bill, and you can do what's called a payroll deduction. And guess what? All the premiums are tax deductible as a expense of the business, right? And I'm sure Zach could also set up that if they are enrolling on this and they're paying dollars on the employee side, these would also qualify for what's called a 125 cafeteria plan. And what that means is the dollars that the employee spends on the health insurance come out pre-tax. So actually the premium is significantly reduced, if you will, if you're going down that road. So these are all things as a benefit. Take advantage of the tax benefits as a business owner. Make sense?
Yeah, absolutely. Thank you for that.
Awesome.
Yep.
Okay, I'm going to show you a couple other really cool features and probably something that you've never seen on a plan like this before. So as I said, I'm the Executive Vice President of Business Development here at ACOS MD. We are a local solution for virtual medicine. And I'm going to show you, let's go back here. I'm going to show you one of the other features that everybody would receive in enrolling in any of these plans. If you roll in one of these plans, you're going to get ACO. So what happens is when I receive eligibility on these plans, which basically means your contact info, you're going to receive an email and a text message saying, welcome to ACOS. And you're going to click on this link and you're going to complete a little information, and ultimately you're going to activate your ACOS account. When you activate your ACOS account, you're going to have access to a dedicated provider and dedicated care navigator. This is concierge level medicine. And that provider is going to engage in all the things that a typical primary care doctor would be engaging in. They're going to help you manage chronic disease. If you have diabetes or high blood pressure, we're going to put you in one of our chronic care management programs. These doctors and our partner doctors, as part of the practice, are available 24/7. So, if it's 3 o'clock in the morning and you have kids, I know I do, gosh, they never get sick during the day. They never get sick during the week. It's always like 8:30 at night on a Saturday, someone has an issue. And now I have to make a decision. Do I go to the emergency room? Do I go to the urgent care? Do I even literally need to go? Am I going to be a bad dad? All those things, right? So there's a number you call, or you go on this website and you say, talk to a provider. And you can click next, and I can say fever. And I hit proceed. Now we have this really cool virtual assistant that you can pump in some information, or if you're impatient and, like me, where I'm a sales guy, so I chase, shiny objects in my backyard with my German Shepherd. I hit collect now, right? And this is our proprietary video technology. It's 256-bit encrypted, uses your camera. And no joke, I'm going into a virtual rating room. In about a minute, someone's going to answer this on RN, and they're going to ask me what I need. I can be connected to a doctor. And then no joke, within about another 30 minutes, I'm at the pharmacy picking up the antibiotic or, whatever that might be, the stuff for pink eye. For some reason, my middle daughter ends up with pink eye. We've had it at 7 o'clock in the morning. We're getting ready for a dance competition, and she has pink eye and her eyes closed. and we have to figure that out. So these are all the really cool things that we can do. The beautiful part about ACOS and the solution that we bring to these plans is we're also going to help you care navigate the healthcare system. So raise your hand if you have a personal assistant. Not many hands raised. I actually do have a personal assistant. I share that person with a couple of the other executives, but I also have a personal assistant in the healthcare world. So her name is Cami, and my doctor's name is Dr. Sloan. So between Dr. Sloan, who's pretty much available anytime, I secure message him, and Cami, they help me navigate the healthcare system. So if I need to get lab work, or I need to get an MRI, or I need to get a referral for a colonoscopy, or et cetera, et cetera, et cetera, I need to find a new prescription or whatever it might be, they're going to help navigate me based on these plans, right? Which is really cool. So they understand these plans, they understand the network, they understand everything about the plans, and they're going to help navigate you to the highest quality provider at the most appropriate location. Okay. Any other questions on the ACOS portal? There's also some other things in here that you can facilitate, like uploading your medical records, any of your healthcare providers. There's a really cool dashboard that's associated with it, a healthcare timeline. There's a lot of really cool technology you can clown around with. It's really unique to this product set. And again, it's all included with these different plans that we're offering here today. Any other questions before we get to the cost? No? Okay, perfect. So let's switch gears here slightly. I'm going to pull up this PDF. What we're going to look for here, and this is all on the website, but this is just easier to show on my screen at one time because the website, you got to put in your age, and it's not age rated. It's the same price no matter what age you are, up to 64. But it does require you to put in your age, and I don't want to clown around with that. And I'll show you all the plans at one time. Okay. Keep in mind, these are ACA compliant plans. They meet both minimum essential coverage for the first two plans, so the primary and the premium, and then the silver and the bronze plans meet what's called minimum value. Hey, raise your hand if you're an employer that has over 50 employees, or an employer that has over 50 employees. Those folks are at risk, right, to penalties around the ACA and the IRS. So it's really important that you connect with Zach if you have that, or you're about to approach more than 50 employees, that you talk to him from some of the compliance things that come into play. Okay. So let's scroll down here. This is a PDF document, and Zach would be able to facilitate that. But on this PDF document, here's the medical plan rates. And there's two components to this. There's the admin cost and the claims cost. Don't focus on that. Just focus on the total cost of each one of the plans. Okay. So as we look, employee is a single, right? So that daughter of yours, she would be an employee only. And if she were to enroll on one of our more popular options, the premium solution, would be about $291.89, okay, on a monthly basis. If you're employee spouse, employee children, or a family, you would go down and scroll. And this is all on the website, so you'll be able to add those dependents and get a total cost. I want to point out, an Ease Silver plan is under $1,000, so $986 is a tremendous value for a family for this type of solution, right? If you were to go onto the exchange today, which you may be, do a little comparison, right? To do my family, there's 5 on the exchange on a silver type of plan would cost me about $2,100 a month, right? So do a little math, make sure you look at the benefits, make sure they're appropriate to you, and then look at the costs involved. And these are very competitive and exclusively, through the chamber.
I don't understand what is the difference between, what is it, admin cost and claims cost?
Yeah, so again, I'm showing you this PDF because it's really easy to facilitate, but this is what your enrollment would look like, right? So what you want to focus on that, let's go back here, is the total cost, right? There's the total cost that's involved. And because of the way these are designed, there's 2 components to a health plan. there's admin costs and claims costs. And fundamentally, this is, the total cost to you, the employee, of the plan.
So in other words, for that individual up in the upper left corner, looking at the Ease primary policy at $140.90 a month, what you're
Yep.
really showing is an itemization of how that 140 breaks down into two separate components
correct.
that are required probably by law or something to,
Yep, on the
where there
plan.
has to be administrative costs and there has to be something contributing toward the claims, right?
That's correct. So if you look, like, for example, so this is the actual enrollment site. And if you look at the premium plan, it's $291.81. And if you go back to the enrollment site, $291.89, right?
Okay.
Pretty cool. Does that make sense?
Thank you. Mhm.
Okay. Any other questions regarding the plans, enrollment? Zach is your guy. He can answer any questions. He can help you connect with the link and enroll. He can help you if you are a business and you want to offer these as an employee benefit to your folks. That's a great idea, especially in these times, for your employees. So we're here to support Zach, and I really appreciate everybody's time this afternoon, and hope this has been some value. I'm here to answer any questions right now as you think about this solution.
David, you mentioned dental. Is there vision included in or available for this?
So there's no vision at the moment.
Okay.
We're always adding new things to the product suite, but no vision at the moment, just the dental plan. Yeah.
Okay. And I had another question. It just eluded me.
David, if I have, a friend of mine that's a pharmacist and he doesn't work at Walgreens, CVS, can I still utilize him for this plan for my prescription drugs?
Sure. Yeah. The pharmacy benefit is accepted at 60 some thousand pharmacies, including all the majors, CVS, Walgreens, Walmart, et cetera, et cetera.
What about the independents though? Is it accepted at a smaller
You'd need to
independent?
check. Yeah, you might need to check. I suspect they are.
Okay.
And David, you mentioned the ACA requirements or what have you. Is there a financial or income limit on these then because they're ACA compliant?
No, there's no income
Doesn't
limit.
matter what income is?
No, it makes no difference. So keep in mind, there's a difference between an on-exchange ACA plan and what we're offering today. So these are not found on the exchange. The only way you can get a subsidy is to go to the exchange, you put in your income, and now you need to facilitate that, right? So that's the only way that this happens.
I see. Thank you.
Yeah.
Any other questions for David?
Are they HSA compliant? I saw there was deductible. I can't remember what.
So these fundamentally, because they have what we call first dollar benefits, are not HSA compliant. So fundamentally, if you purchase these plans, technically you can't contribute to an HSA while you're on these plans. Now, if you have an HSA and you've already contributed to the HSA, you can use those HSA dollars to facilitate copays or facilitate, whatever. But you can't contribute to an HSA while you are, engaged with these plans technically, right? Technically. So that's kind of how it works. And quite frankly, an HSA is a great strategy. I think people kind of fail on the spirit of the HSA. It's really as a tax deferred method to not spend right now, right? So if you have an HSA, the goal is to get that into retirement as another strategy for paying healthcare later in life, not necessarily paying for healthcare right now. I would much rather see someone, an employer, frankly, use an HRA, health reimbursement, to pay for stuff right now, as opposed to an HSA. For those folks that are in a higher income bracket, an HSA is a great way to stockpile money for future, healthcare expenses, when you retire, et cetera, et cetera. And that's just my take on HSAs.
Mhm.
And I see
David,
Carolyn, I see Carolyn's
question.
back and she's nodding her head.
And HSA is a tax deductible opportunity for those higher income earners too.
That's correct. Yep.
That is, do you guys, I maybe missed that, but do you guys do HSAs?
No,
No, okay.
I'm sure Zach has access to HSAs and HRAs and all sorts of other ways to facilitate tax advantages, both for solopreneurs as well as business owners, with employees. So there's lots of ways to leverage the current IRS tax rules with these types of strategies. For a $10 or $15 an hour employee, I'm going to say
Right.
you'd be better off buying life insurance for that person than giving them an HSA because they're not going to contribute to it anyway.
Right.
But if you're making $150,000 a year, an HSA starts to make a lot of sense in many circumstances.
And you do those for single employee groups, Zach?
You're on mute, Z-Man.
mute.
Guys, yes, in regards to single employee groups, we have access to somebody that can set those up.
I've got my list. I think we need to talk.
Which brings
So
me
I
to the next point. If you haven't put your contact information in the chat window, if you don't have each other's contact information, go ahead and take care of that here as
I
well
was gonna
today.
say, I missed most of this. I'm so sorry. Can I just get a phone number of who I need to talk to so I can kind of have them repeat everything to me?
We're recording it.
Yeah, I'm
You are
recording it
recording?
for you, Deanna. So I'll have this posted up on our chamber website.
I
And I think
Hopefully this
Zach, you
weekend I'll
put
get
your information in the chat bar as well, right?
I'll go ahead and put my information in the chat bar again, just in case it's not popping up for you.
And maybe I need to, I don't know. I just stopped sharing my screen. Now I can see the chat bar. I don't know what that means. Maybe I was kind of screwing that up by sharing my screen.
No,
But I do
you were
see-
fine. I was able to see the
Okay.
chat throughout your presentation. So it turns out the chat window we've discovered over the 7 months of COVID that when you jump into the call, you can only see the chat from the point you came into the call forward. So since Deanna just came in recently, she's not going to see any activity in the chat window until the moment that she's been on the call. The history's not there.
There you go.
So
And I
I
think Zach just-
often save the chat window and then I can shoot it out to anybody that needs it after the call. So,
Awesome.
but there you go, Deanna. You got Zach's information if you need it.
Thank you.
So I have one more question, and maybe, I don't know if it's a question for David or Zach, but it's about the network doctors. And it sounds like, of course, you have a broad stretch for doctors, but my question would be, do you also include naturopathic doctors and others in, because that's what I use my HSA funds for, right? That most doctors aren't for naturopathic care and alternative options aren't covered
Sure.
in
So
insurance.
what I would recommend, and I don't even like to speculate because in the world of, who's in the network, it changes,
Yeah.
minute by minute. So
Yeah.
literally, I'm not even joking. So what I would recommend, get in contact with Zach, and then he
Okay.
can provide you with the links to, on the first two plans, he'd give you 2 links. One would be for First Health, one would be for PHCS. On the second 2 plans, the bronze and the silver, it would be for the PHCS or multi-plan, and it's the physician and ancillary network. And you would click on that link, you'd pop in the doctor and see if that particular provider is on the plan, whether they're a DO, an MD, naturopath, et cetera, et cetera.
Thank you.
Yeah, my pleasure.
So Zach, all the links to for instance, the chamber portal that was set up for us and et cetera, you'll have those available to us then after the call. You get those to me and I'll shoot them out to the membership.
I'll get them pulled up. I'll send them to you, Tom, in an email so you can blast them out.
Okay, and I'll blast that out to the chamber members as well as a link to this recording when we're done so that all 150 of us or so will be read in.
Awesome. Well, Tom, thank you so much for having me. Zach, again, chamber members, really appreciate the opportunity to present you with some of these solutions. I mean, year over year, Gallup does a poll. What's the top concern on people's minds? And healthcare is the #1 concern every year for the last 5 years running. And you know, for a lot of us with COVID and this and that, it's been a real adjustment, right, to a new normal. The concept of virtual medicine. I mean, gosh, I haven't seen my DPC doctor, but like I think once, maybe twice in the last 2 years. I just do it from my house, right? It's really simple. And these plans are just super easy to use and again, super affordable. So I encourage everyone to get in touch with Zach and he has all the information. And I appreciate your time this afternoon.
And it looks like ACOS is a great fit for what we've been trying to put together here for several years of finding something that will work for chamber members.
Yeah.
And no one's been able to answer this question for me. Zach worked hard at it and found you, David. So thank you, both of you, for all the hard work. Carolyn, you've got something else.
Yeah, so later this month on the chamber calendar, we've actually got a webinar scheduled, healthcare in retirement, because the cost of healthcare can blow up a retirement plan. So this is very timely information. So if I know most of us here aren't even close to retirement age, but if anyone wants to jump in and kind of listen to that or bring clients or families on that webinar, because the costs of healthcare a lot of times are not factored in appropriately. And then what they thought they could live on income-wise in retirement isn't.
Just got whacked. So we've got your webinar is on our chamber calendar.
Yes.
Okay. I'll make sure to promote that out as well for you.
Yeah.
A little
Yeah,
bit of
that's on the
housekeeping.
Zoom
I
link.
noticed there was a link through the chamber that he was utilizing to get to this. I tried to find it while he was trying. Is there a way we can put that into the chat also so people can just click on it?
I'm not sure if I have a Zoom link even scheduled yet for it. I'll check. So probably not for today. Are you talking about the webinar?
No,
for-
I'm talking about the healthcare.
What we just covered.
Oh,
Yeah.
Zach is going to send me a link and we're going to get it added to the chamber website, but he's going to get me a link. He'll get me a link today as soon as we're off the call, I think he said.
Yeah, that'd be great if that was like on front and center.
Yeah, we'll get it up for you, Barry.